Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
My name is Ralph, and I am an ITU nurse.
Sometimes nurses attend our London courses from as far away as Glasgow, Cardiff and Portsmouth. Thank you. Sometimes nurses would like to attend our outstanding OSCE courses but for various reasons can't make it here. It's okay, we hear you. Here at IELTS Medical, we're currently working on reaching every nurse wherever you are in the world. In the meantime though, we've got our video course and textbook package called The Ultimate Guide to the NMC OSCE. Your guide includes the theory for the exam, as well as vouchers for 1 or 2 6-hour sessions with our OSCE educators. Grab your ultimate guide at oscenurses.com today.
Why don't you try London na mag-apply? There are many vacancies or openings. So I tried one online.
Man knows best.
Usually we do have trainings. They call it competencies. That's part of the National Competency Framework of registered nurses working in adult critical care. Actually, nandito po siya sa sa harap ko. Which is I'm still completing at the moment. This is what they call as step 1. Yeah. So that's from the critical care network. So andito lahat ng competencies na kailangan to be able to yes, it's quite tedious. It's quite comprehensive, so to speak. Tapos may step 2 pa po siya. That's the proper intro course. They call it intro course. Step 2 na po 'yon. So, mas detailed na, mas intense, hence it's called intensive, mas intense na siya. You should know the pathophysiology, everything. Bakit nangyayari ito, how this works, bakit binibigay mo tong medications na to, bakit CT scan, and so on and so forth. So,
Man knows best.
they have really great support in here. Napakaganda ng supporting system dito, from the matrons down to yung mga colleagues mo na on your same band level. So yeah, definitely they always ask me na don't hesitate to ask questions. There's no stupid questions. Actually, if you're new in critical care, you don't have that experience back home especially. So you don't have that knowledge on the machineries, on the routine procedures that they usually do in intensive care. So, yun po.
Man knows best.
Ang pinaka-pro, because this is a specialized training. So, thereby, you have that know-how on how to take care of level 3 patients. They call it level 3 kasi hindi lang minsan single organ failure, it could be double organ failure or everything. So remember, if in intensive care, talagang we're on the verge of life and death. So if that patient, meron ka ng kakayahan, you have the ability to have that clinical judgment, you have that problem solving skills, you have that troubleshooting, you have and combination, especially sa yung values natin of compassionate care with that quality standard that the trust is expecting, kaya nating mag-alaga ng level 3 patient. So we can also have that time to take care of level 2, level 1 patients, yung mga step down patients pa. So yun yung advantage. If kung kaya mo na mag-alaga ng sickest of the sick or poorliest of the poorly patient, kaya mo na rin mag-alaga ng stable patients until they will be discharged. I think that's one of the pros of being an ICU nurse. Pangalawa, as I've said, we have learnings, a lot of learnings. If you're into the basics of learning everything from A to E, from the airway up to the exposure, I think intensive care is the best for you kasi marami ka talagang matututunan. Ayun.
Man knows best.
The disadvantage is yung burnout. Yun. Nakaka-burnout minsan. Ayoko na. I need a break. Ganyan. You know? Luckily, my trust is having separate breaks. May mga 15 minutes, 30 minutes, depending how busy the area is. But yeah, may allocation ng breaks, no? Which is good kasi kailangan mo rin ng pahinga, di ba? Kasi every second counts sa kanila eh. Once you're at the bedside, nag-iisip ka na ano bang next kong gagawin dito? Anong next kong gagawin? Maglilinis na ba ako? Ganyan. Pati paglilinis, siniisip mo yan eh. Kasi you don't want the patient to acquire infection. Makikita mo mga Pilipino sa IT yung mga naglilinis yan ng bed space. Ganun. Because we don't want, kasi infection control din po yun. Ayun. Yung mga simple na ganun. Tapos monitoring, very important sa ICU ang monitoring. Kaya minsan talagang burnout ka, very it's taxing, especially if the patients are delirious, more than 70% according to some literatures. Delirium is one of the most common occurrences happening in critical care.
The side effect, the water is what's been screwing up the sodium level.
It's causing his delirium.
Another problem or disadvantage in critical care, yung moral distress.
Manong knows best.
My advice is, you have to, even if you have to go back to zero, kasi lahat naman tayo nagiging advanced beginner eh. For me, marami kang matututunan once nasa ICU ka. In so many ways. But siguro ito lang masasabi ko, you have to go with the protocol, with the policy, with the guidelines. Kasi yun ang magsasave sa iyo.
Always remember, Manong knows.
Manong knows best. Put your worries to rest when staying in the United Kingdom.